Welcome to episode 1 of our Chiropractic Assistant Training Program, Interview Techniques. In both this and the next episode, we're focusing on one of the most important aspects of your role, interviewing patients. This foundational skill is critical for gathering the information that will guide the chiropractor in developing an effective treatment plan. Let's discuss some interview techniques that will help you gather this information effectively. 1. One key technique is facilitation. This means guiding the patient to keep talking by saying phrases such as, "I see," or "go on." 2. Reflective listening. Echo the patient's statements to show understanding and encourage them to elaborate. For example, if a patient says, "I've been feeling anxious about the pain," you might respond with, "It sounds like the pain has been causing you a lot of anxiety." 3. Paraphrasing. Rephrase what the patient has said in your own words to confirm understanding. For instance, "So, if I'm hearing you correctly, you're saying that the pain started after lifting something heavy." 4. Open-ended questions. Ask questions that require more than a yes or no answer to gather detailed responses. For example, ask, "Can you describe how the pain affects your daily life?" 5. Silence. Use pauses strategically to give patients time to think and respond. Sometimes a brief silence can encourage patients to share more information or elaborate on their answers. 6. Encouraging statements. Use phrases such as, "Tell me more about that," or "I'd like to hear more about how that affects you," to prompt the patient to provide additional details. 7. Nonverbal cues. Use body language such as nodding or maintaining eye contact to show attentiveness. This helps in building trust so the patient can feel more comfortable sharing their information. 8. Clarification. If a patient mentions something unclear, ask follow-up questions. For example, if they say they've been feeling off, then ask, "Can you describe what you mean by off?" 9. Summarization. Periodically summarize the key points of what the patient has shared to ensure accuracy and clarity. For instance, you might say, "So you've been experiencing lower back pain for the past 2 weeks, especially when sitting for long periods. Is that correct?" 10. Empathy. Show understanding and concern for the patient's situation. Phrases like, "That sounds painful," or "I'm sorry to hear you've been dealing with that," can make patients feel supported. 11. Echoing. Repeat key words or phrases that the patient uses. This technique encourages the patient to expand on their thoughts. For example, if they say, "I've been having this sharp pain," you might respond, "Sharp pain?" By mastering these and other interview techniques, you'll be able to gather complete and accurate information when taking the patient history, which we'll go over in episode 2.